there. Okay, so finally, we've got our keynote speaker today is Dr. Sushil Baral. Now, Sushil started his work as a community health worker in a remote mountain in Nepal. He's since then has developed into a public health researcher with more than 30 years' experience in health systems and health policy at national and international levels. This includes as a DFID health advisor, supporting the Nepal health sector programs, and also strategically engaged in the humanitarian and health response during the earthquake, the 2015 earthquake in Nepal. He is the PI of a range of lots of different research programs, including Rebuild for Resilience, and he's the managing director of HERD International in Nepal. He's got a really great story to tell you here, so I'll move aside and let him come on. Thank you.
Thank you, Joe. Good afternoon, everyone. A very warm welcome for the next 20 minutes of my talk. Okay, I call it Namaste at the very beginning. I wish I had this like this, Namaste. It's a real pleasure and honor to be here today, and extend my gratitude to the organizers for this opportunity to talk on this very complex topic, but I'll try to simplify in my talk with the lessons that I learned over the last 30 years. I represent HERD International, which is a research organization, primarily working in terms of generating evidence in health systems and translating evidence through the knowledge, being a knowledge broker between the researchers as well as the policy practitioners. And one of my difficult jobs I have been trying to do, but with so many attempts to success. Today, I bring with me not just the organizational insights, but my personal experience from a truly remarkable place, a land of Himalayas, a brave Gurkhas, beautiful natural scenery in Nepal, and on top of that all, the resilient people. Nepal is my country where I grew up, where I lived, where I learned, where I educated. And I dedicated my almost 30 years of golden age in strengthening the health systems. So I'll be taking this journey, shaped with my experience of resilience, a way of life in Nepal. I call it resilience is not a different. It's a way of life in Nepal. We face everyday reality. And I'm honored to share those lessons with you today. In the next 20 minutes, with the photographs on the side, which captures basically the sense of resilience in practice, reflecting the strength, adaptability, and the lasting hope of the community. My insights are drawn primarily from Nepal, although I worked in global health for a long time. I request for your understanding here if my experience feels too narrow to feed your intellectual curiosity here. Let me start this journey, begin with the story of a community health workers from 1990. In one of the mountain district, remote mountain district, underserved, which I want to use to exemplify how I experience, how I define resilience in practice through the lens of a community health worker. And I feel very proud to be called community health worker till today. Despite the extreme poverty and geographic isolation of the districts, with the high maternal mortality, child mortality, I, as a community health worker at the age of 18, transformed a cow shed to start a community health clinic up in the mountain. And the village, we had to walk up to 7 days to connect to a road with the extreme difficulties, extreme weather conditions, but very beautiful community and the people who were driven by hope for change. Over a decade, Nepal's health systems really experienced significant challenges, including a lot of policy shifts towards addressing disparities. So I call this journey a resilience in practice, disparity to dignity, a way forward with the hope. A lot of policy shifts at different point of time, including the natural disasters such as 2015 COVID-19 earthquake, COVID-19 pandemic, which exposed the vulnerability, but also showcased, even though very poorly functioning health systems in Nepal, but with the level of resiliency, with a strong community engagement, community network into play in order to deal with the everyday resiliency in health systems. This experience basically highlights the resilience both in health systems as well as the community amongst the different layered crises that often we faced in Nepal. Perhaps you agree with me, the context plays a critical role here in shaping or reshaping or de-shaping the resilience in health systems in practice. Particularly a country like Nepal, where the resource limited, where the challenges are enormous in health systems, like inadequate infrastructures, health workforce shortages of drugs and supplies, financial burdens, and intensifying inequities across the health systems and the community. Overlapping crises, including natural disasters, political instability, and routine stresses, highlight the need for resilience beyond the crisis and recovery. However, what we have faced is resilience is often under-prioritized only in favor of the immediate needs, leaving a long-term vulnerability in the system. To build resilient health system, it is crucial to address the systemic limitations that we are facing. Invest in the long-term capacity. I really mention it. It's a long-term capacity of the system that we need to invest and adapt strategies that are contextually tailored, locally informed, that ensures health systems can manage the multiple vulnerabilities that they face. With this, let me bring you to how we define the health system resilience in practice. You all know that. I mean, when we talk about resilience, what we talk often is prepare, respond, and recover from the crisis. A bouncing back health system to address the crisis while delivering the basic essence as we continue to deliver. But defining resilience in these settings also means knowing the level of details about the unique barriers that continuously health systems face in southern part of the world in particular, such as very weak supply of regular medicines, shortages of health workers, inadequate information systems or underutilized data that's been collected in the routine health systems, which can hinder the effective response and recovery efforts. The concept goes beyond merely a recovery when we talk about resilience health systems. It highlights the system's capacity to learn and improve the response. Health system resilience in the resource-limited setting often relies on proactive planning. So let me go key attributes or how the health system resilience can affect effectively into the practice. Lot of, as previous speakers said several times, it requires a lot of anticipation, preparedness, and responsiveness within the systems. Proactive planning, the adaptability, and equity-driven approaches are the key attributes that we need to take into account when we talk about resilience in practice in a resource-limited setting. Also, these key attributes include anticipating and preparing for crisis, using a real-time data in decision-making, adapting to the shifting needs of the population, and fostering community trust. At the heart of the resilience I see here is the community engagement, which basically builds on the equitable care for all with the robust primary healthcare system. At the heart of the resilience, I would say the robust primary healthcare system, which serves as the first point of contact for many populations, particularly in rural areas of Nepal, that ensures health systems are better equipped. So I would urge investing more, strengthening the primary healthcare system, along with a strong community engagement in practice, in order to address this multiple crisis that the health system is facing. I bring this slide to really put the equity in focus as a part of resilience here. These slides basically highlight the critical connections between the health equity and health system resilience in practice. I use Nepal's maternal mortality and child mortality indicator as an example. Looking at Nepal over the last 25 years, the maternal mortality ratio has been reduced by 72%. A great achievement. We should be clapping it in a resource-limited setting. However, the point to be noted here is the equity, equitable distribution of health outcomes. These outcomes are unevenly distributed across the provinces and the group, leaving with a wider disparity in the community. Still, a good number of women dying from the underserved population, which is unacceptable, unbearable in this modern world. Health equity, to me, it's not just be realized as an ethical goal, which we often read and sign up. But a foundation of resilient health system has to be the equitable health systems. Equity in focus is important, which disproportionately affect the vulnerable population and who are the first affected population when there is a crisis. So these indicators really highlight how we address the systemic inequity while achieving higher gains across the wider populations. This is another form of economic case of inequity. These slides basically highlight the high out-of-pocket expenditure, and the poor quality undermines the health system resilience in resource-limited setting. In our experience in LMIC context, where we invested quite a huge amount of resources in terms of enhancing the coverage, but we failed to enhance the coverage with the good quality services. Somehow, during the process journey of the expanding the coverage, we compromise the quality, which has a big impact in terms of resilient health systems, and particularly for the marginalized population. So, resilient health system must prioritize financial protections, equitable access to care, and quality improvements to mitigate the economic hardship, particularly among the vulnerable population. So strengthening health financing systems, if we really want to progress towards the USC with the resilient health systems, then this is something we must consider, fostering adaptive, equitable, and sustainable health systems towards that. This is a framework we developed in Reveal for Resilience Research. So I really want to connect this slide here, an ongoing participatory action research under the Reveal for Resilience Consortia, which aimed at enhancing the local health system in fragile setting. It moves beyond the routine WHO building blocks when it comes to seeing the resilience in practice. It highlights both well-understood elements of the resilience, like recovery, emergency planning processes. There are also less focused dots here. This framework connects more effectively, such as the social cohesion, the informal networks, the gender and intersectionality, and the indigenous knowledge and adaptive leadership. So applied in this framework in Nepal, the focus is on integrating these aspects to help the system to observe, to adapt, and to transform the response in crisis in our learning site. So this basically connects us with the wider system to the resilience framework. Nepal recently decentralized. We have 753 local governments to tackle with the basic health services. And resilience is a long journey in terms of enhancing capacity. So these slides basically, in our early findings from learning site, connects that decentralized local governments has ability to strengthen resilience capacity by shifting the power and increasing the flexibility and enabling local decision-making processes with a greater use of local evidence in decision-making. However, poorly managed decentralized systems can challenge, such as a risk in inefficiencies, dependency, financial instability, and fragmentation. So my urge here, with the very early experience of Nepal's decentralized, Big Bang decentralization, I would say the effective decentralization requires a very good balance between the fund, functions, and functionaries that is taken into account. So the exploring known and unknowns here, the health system resilience in resource-limited setting involves known principles like preparedness is key, multi-sectoral collaboration is key, and the community-driven approaches are essential, but gap persist in application of these in real-world setting. Challenges includes addressing the polycrisis, adapting these strategies in the local context, and ensuring a long-term sustainability. This is my final slide. It outlines basically the essential pathways of achieving health systems in resource-limited setting like Nepal. Building resilience in resource-limited setting requires moving beyond the reactive crisis management approach to proactive, embedded sustainability and the equity into health systems. So it requires a robust primary health care. This is being a community health worker spanning up in the Himalayas for a good number of years. I really focus on strengthening the primary health care when we come to the resilience health systems. So the locally tailored participatory approaches that ensures the resilience strategy that are more context specific and needs to be really developed towards more vulnerable populations efficiency. In resource-constrained setting environment where addressing this polycrisis demands integrated and more flexible approaches. I'm quite happy to listen all the previous speakers about the adaptability, the flexibility that they had working in fragile setting and the context. So resilience must become an everyday business, deeply rooted in our routine operations, planning and governance, rather than dealing in silos or linking to any particular event only. This long-term investment that prioritizes the value-driven results within the resource constraint. Above all, I must say that equity must remain at the center of the resilience when we talk about this. So reflecting on my journey, which began as a community health worker in 1990, and evolved through the various roles over the 3 decades, I recognize recurring challenges in the system. We have beautiful policies been developed globally, locally. However, policies remain unfulfilled in practice. The implementation of these policies in practice requires a different perspective, different thoughts, different turning points. Yet, I firmly believe that leveraging what we already know and maximizing the potential of existing resources to drive the transformative change, building resilient health system is not just about bringing another strategy, another center, another framework. Rather, it is operationalizing the existing knowledge, the fostering partnership and collaboration, and making every resources count for impactful results and sustainable solutions. Thank you very much for listening. Thank you once again.
Oh, thanks so much, Sushil. That was absolutely fantastic to hear that whole journey and that sort of resilience in practice. It's really, really good messaging there. Thank you so much. I am very conscious of 12:30 now, so I keep your questions so that you can come and talk to Sushil after this session, because I know there's another lunchtime session that people want to go to. But just